Good afternoon, everyone. Thank you for joining us today. This series was made possible in part through the generosity of Amgen, and we thank them for their support. My name is Florencia Nachetto, and I'm the Senior Director of Health Initiatives and Education here at the American Kidney Fund. Before I turn over the presentation to today's speaker, I'd like to direct your attention to the control panel that you see on your screen. All participants are on mute, so we won't be able to hear you, but we welcome your questions. If you have a question, please type it into the section of the control panel called Questions. We'll see your questions and we'll do our best to answer them, either by replying to you in the questions box or out loud during the last several minutes of the presentation. This webinar is being recorded and will be made available for viewing on our website at kidneyfund.org/webinars within the next 1 to 2 weeks. So then let me go ahead and just start over by introducing Dr. Ken Wilund. He's an associate professor in the Department of Kinesiology and Community Health and Division of Nutritional Sciences at the University of Illinois at Urbana-Champaign. Dr. Wilund received his BS in Nutritional Sciences and his PhD in Kinesiology from the University of Maryland and completed a postdoctoral research fellowship in the Department of Molecular Genetics at the University of Texas Southwestern Medical Center. The primary focus of the research in Dr. Wilund's lab is to examine the individual and combined effects of exercise training and nutritional factors on the health and quality of life of patients with kidney disease undergoing maintenance dialysis therapy. Much of his work focuses on the intradialytic period, as past research indicates that the hemodialysis procedure is associated with acute episodes of inflammation and oxidative stress that contribute to cardiovascular complications, muscle wasting, and other comorbidities. One of its largest studies to date is an NIH-funded clinical trial examining the efficacy of intradialytic whey protein supplementation and exercise training, or cycling, on cardiovascular disease risk and physical function. He is currently conducting a pilot study aimed at optimizing cardiovascular health and physical function in hemodialysis patients using a novel protocol for reducing chronic volume overload in combination with a comprehensive exercise training program. These projects each support the overall research goal in his lab of examining the efficacy of novel approaches for improving the health and quality of life of patients with kidney failure. Dr. Wilund has more than 70 peer-reviewed journal articles and is a member of the American College of Sports Medicine, the American Society of Nephrology, the International Society of Nephrology, and the International Society of Renal Nutrition and Metabolism. Thank you so much, Dr. Wilund, for joining us.
Great, thank you. Sorry, I got cut off in the middle of that, but I'm back on, so I hope all is well. So yeah, today I'm going to talk about a topic that's a lot of interest and passion to me. I've been working with patients with kidney failure for almost 10 years now, and learned a lot along the way. So one of the things I want to mention straight off the bat is that my talk, it's going to be littered with, I think, a lot of optimism throughout it, but also a heavy dose of reality. Because at the end of the day, the message that I really want to convey is that I think exercise, and I hope people don't get the wrong impression as I go through this, is I think exercise is one of the most important things dialysis patients and CKD patients in general can do for themselves. But the truth of the matter is it doesn't always work that well in a lot of people, and a lot of patients, and I think I have some understanding of why that is, and I'll talk about that. And this is one of the reasons why so many patients, I think, remain sedentary. I do think exercise is great medicine, but we need the right kind and optimal dose of exercise to really, and we need people to actually consume it, just like they would a drug. And then you can get great benefits from it. So with that in mind, the objectives, you can read them there, but what I'm really going to talk about is just some of the background, some of the previous studies that have been done, looking at the benefits of exercise in dialysis patients, including some of what hasn't worked. I'm going to talk about some of the reasons for the poor adoption of exercise by patients and some strategies for overcoming them, as well as outline strategies for incorporating more exercise into your life as a patient, and as well as the types of different exercises. So, next slide, please. So, first of all, I just want to mention, I don't think this is a big surprise that CKD patients are a very inactive population. Most dialysis patients are about 60% less active than age-matched healthy individuals. And this slide demonstrates some of that. You look at the percentage of individuals, the red bar there, that are completely inactive, almost about 70% when you get to CKD stage 4 and 5, and there's 5 being those are mostly on dialysis. Next slide. Next slide, please. So why is this? Why, just in general, why are dialysis patients so inactive, and why are we so inactive as a society in general, really? There's a lot of reasons for this. A couple common reasons: people's fear of injury or some comorbid diseases they have, exacerbating those. But we've also introduced a lot of creature comforts, conveniences, modernization into our life that prevents us from being more active. We've become a nation that enjoys a lot of sedentary type recreational activities, such as watching TV. And one thing that I don't think a lot of people talk about is the fact that as we get older, in particular, exercise becomes very boring because we do boring stuff, and we used to do fun stuff when we were kids. We used to have a competitive nature about us, and we lose that as we get older, and certainly as we get chronic diseases. So just another way of restating these reasons for inactivity, I think the big ones, we've engineered a lot of activity out of our life, and we've got to change that. We worry too much about getting hurt and causing harm when the bigger problem is being inactive. And as we get older, we really forgotten how to have fun with exercise. And when you add on top of this the rigors of dialysis, where lack of time due to dialysis sessions that they take up, a lot of post-dialysis nausea and fatigue, as well as the presence of a lot of different comorbid diseases, you've got a recipe for a lot of inactivity. Next. So I want to talk a little about some of the, you can categorize exercise for dialysis patients. Most of the studies that have looked at the benefits of exercise in dialysis patients have used what's known as intradialytic exercise, or exercise during treatment. And I'm sure most of you have familiar with the biking during treatment. A lot of facilities have at least tried this. And one of the reasons we do exercise during dialysis is because you've got this relatively captive audience. They come to the clinic, and you don't have to get them to go anywhere else. They show up. If you show up to the clinic, they'll normally be there. The patients will. But obviously, there's concerns with this type of exercise because the patients are strapped to a chair. They have limited mobility. So most of the studies have used intradialytic cycling. There's a picture on the right where you see the cycling, somebody cycling during the treatment. And it is very feasible to do, and it's what we know most about because that's where most of the data is. But people have also tried to do strength training during dialysis using weights like dumbbells or ankle weights, and do leg exercises with ankle weights and bands and things like that. But it's very difficult to do strength training during dialysis, although there are some benefits to that. We'll talk about that. But obviously, you can also exercise not during dialysis. You have many more options, going to the gym, playing sports, doing anything that you normally consider as physical activity and exercise. But these types of out-of-clinic exercise in dialysis patients is very difficult for a variety of reasons. The access to equipment, to gyms, to motivating patients is difficult outside of the clinic, and it's not supervised activity, so compliance is pretty low. Next. So I want to talk a little bit about these intradialytic exercise programs. There's a lot of nephrologists and nurses and everybody else at the clinic probably talk to patients about the importance of exercise on one time or another, but very few clinics, especially in the United States, offer any intradialytic exercise programs. So this is a graph showing the percentage of facilities in different countries. And you see in the U.S. way on the right, only about 20% of clinics in the U.S. offer an intradialytic exercise program, whereas some other countries like Germany and Switzerland, the percentage is much higher. I actually think this 20% in the U.S. is actually probably an overestimation as well. So very few programs are offered in clinics in the United States. So why don't we have more intradialytic exercise programs? There's a number of different barriers that have been cited in different studies related to why there's not more intradialytic exercise. I've categorized these into three basic categories: patient-related, barriers such as poor health and fatigue of the patients. Patients don't have a lot of time, maybe knowledge about exercise is low, and their confidence in their ability to do exercise is also low. And they don't have a lot of access to equipment. Most facilities don't have exercise equipment, so that's a big problem. There's also some clinic staff-related barriers, such as staff burden. The nurses and techs have a lot to do, and they don't feel they have the time to really help promote exercise oftentimes. And then they don't have the expertise to do so. And a lot of times nephrologists kind of pay lip service to an exercise program. Some are very supportive, but most don't spend a lot of time promoting programs. There's, of course, financial barriers. Who's going to pay for an exercise program? It would be easiest if we have exercise physiologists or physiotherapists in the clinic, but somebody's got to pay for that. So usually what happens when a clinic is associated with a research grant, there can be an active program, but when the grant ends, the program ends. Next. But one barrier that I think really few people really want to talk about is that there's a lot of nephrologists that are kind of skeptical about the benefits of exercise in dialysis patients. And I know this for a fact from talking to a lot of nephrologists. Nurses and techs as well have often voiced concerns about the effectiveness of exercise during dialysis, about the cost of it, about the safety of it, and the burden it has on the staff. Next. So why is there this doubt about exercise? And don't we have tons of evidence that it works? And if you read a lot of sort of review papers in the scientific literature, they talk glowingly about the benefits of exercise. In fact, there's been a number of studies that have demonstrated improvements in muscle mass and strength and the health of your heart and arteries. Another important outcome has been shown to improve dialysis efficiency, so how well toxins are removed from your blood. And this makes some sense because during exercise, your blood is being perfused into the skeletal muscle, so it helps remove some of the toxins. And really also quality of life has been improved in some studies. But a lot of problems that when you really read this literature closely, the studies that have been done are generally small, and really the magnitude of the benefits, even though they're generally there, they are reasonably small. They're not overwhelming benefits. And so they're not overly convincing to a lot of nephrologists and nurses, and without the overwhelming evidence, their enthusiasm for these programs is minimal. And the programs are difficult to implement because of lack of time and resources. So the consequence of this is that the clinic staff is not promoting exercise in the majority of clinics. Next. So what are some of the reasons for this uninspiring data? And this is where I said I'm going to sprinkle a lot of optimism with some either pessimism or realism. The fact is, in many studies, the exercise volume, the amount of exercise and the intensity of the exercise that's been done has been incredibly low. So you've got low intensity cycling that's been done usually for about 20 minutes a day for 3 days a week. It's about an hour a week. And that's just not a lot of exercise. And if you look at it from the amount of energy that's expended during the exercise, some studies 35 calories per session, 70 calories per session. That's a candy bar has about 200 calories in it. So you're looking at a fraction of, burning off a fraction of a candy bar in a session. And that's not going to necessarily get it done most of the time in terms of really improving people's health. Some think patients dialysis patients in particular, are just too sick. Their arteries are too damaged or calcified. Their muscles may be too damaged or too weak to adapt. I don't necessarily think these are true, but that's some of the thoughts that others have had. Next. So when you really think about what we're asking exercise to do, and I think this is a really important message, that what I'm showing on the slide is just the fact that what everybody knows, chronic kidney disease is associated with a whole bunch of different comorbidities. You have muscle wasting, you have CKD mineral and bone disorder, you have cardiovascular complications, and it's really difficult to contemplate the fact that putting a bike in front of somebody 20 minutes a day, 3 days a week is going to have a significant impact on all these problems that they have. I've seen it work, but it's not guaranteed that a small amount of exercise is going to have a significant impact on a lot of these different outcomes. So next slide. But I want to give you a lot of optimism as well, because I'm still very optimistic about the benefits of exercise. And here's some anecdotes I'm going to go through real quick to demonstrate why I am so positive about the stuff we're trying to do and the benefits of exercise. Many of you may have heard of this guy, Shad Ireland. If not, I've provided his website. This individual, interesting story. Age 11, he had kidney failure. He started dialysis. He had a couple failed transplants. He was wasting. He weighed 85 pounds, and he was sitting around his house. He said he was drinking a lot, and he just became captivated watching an Ironman triathlon and decided, for whatever reason at that point, to try to turn his life around. And now he's an Ironman triathlete. If you don't know what an Ironman is, this is this is a competition where they swim, I think, for 2 miles, they bike for 110 miles or something like that, and then run a marathon at the end of that. So it usually takes about 6, 8, 10, 12 hours to complete. And this guy's done multiple of these things. The point is, this is a patient that there's no drug, no pharmacological therapy is going to save this guy's life at this point, but exercise did. So when people tell me that exercise doesn't work really well in this population, I point them to this story. And granted, he's not a 70-year-old dialysis patient. He was younger. But this stuff works if the prescription is adequate. I don't expect most patients to be able to, do this, but the point being, if we do more with patients, we can expect more. Next. So I've had some very successful anecdotes from my lab as well. I had a large NIH-funded trial that just finished about a year ago, publishing the data now, but by and large, the data was rather negative from my own study. But it involved cycling during treatment for about 45 minutes a day, 3 days a week. And while the overall study results weren't impressive, we had some amazing anecdotes. This is the first one. We had a 35-year-old African-American male, sedentary, obese, hypertensive, diabetic. He had a large weight gain during his typical dialysis treatment, about 5 kilograms every other day. He was in our exercise group that cycled, but we could not really get him to comply with what we were asking. So I was up there one day at the clinic, and he came in. He'd been cramping on a Friday. This was on a Monday when I came in to see him. But he had explained to me he'd been cramping on the last Friday, and they gave him some saline. He just got really thirsty. And over the weekend, the guy drank 10 liters of soda. And his weight gain, I think it's cut off there, but his weight gain over the weekend was 15 kilos. So not surprising. I'm sticking a bike in front of this guy, hoping that solve all his problems. But he finished this study and saw 0 benefits from our intervention. And we took the bike away, and after 2 weeks, he started asking for it back for whatever reason. He all of a sudden got motivated after he was out of the study. He started cycling more. We convinced him to change his diet. The guy lost 40 pounds and got a transplant. Now, this is an amazing anecdote. We essentially saved this guy's life by sticking a bike in front of him, but my clinical trial, funded by National Institutes of Health, didn't show any benefit, at least in terms of this guy. But it was tremendous success. Next. Another anecdote. 60-year-old Caucasian male with severe depression. He was in our exercise group. He was cycling for 45 minutes a day. He completed most exercise sessions, but at very low intensity. He saw very few improvements after 1 year of doing this exercise in terms of his heart and artery health and muscles and all that stuff, strength. But his depression and quality of life indices really improved. In fact, he told us that he was contemplating suicide, and this bike saved his life. My study outcomes showed no benefit, but again, tremendous benefit. And the take-home message from this guy is we've got a lot of evidence that exercise benefits mental health and well-being. It's one of the great reasons to exercise, especially for dialysis patients. It's not always about the muscle and the heart. The mind can really benefit as well. Next. So last anecdote I have, but I think they're important. This is a guy who was in our actually a control group. It's a randomized study where we had a control group that did not exercise for a year, and he was kind of mad about getting into that group. But after he got out of the control group, after the year, we gave him a bike, and he actually bought a bike at home, started exercising a lot, changed his diet, lost weight, got a transplant. Another example of a bike saving a life, but my study showed no benefit because he was in my control group. So 3 really nice anecdotes from our clinical trial that on paper doesn't look very impressive. Next. Some other anecdotes are, we have failed, unfortunately, with our patients improving their health and behaviors much more frequently than we've succeeded with them. Unfortunately, African American women in particular, for whatever reason, with us, have been especially difficult to get them to change their behaviors. And we're working on some, we're trying to do some new things to motivate this population. And we've also learned it might take patients more than a year to change their behavior. And most clinical trials are less than a year, so you don't see the benefits. Next. So how can we be successful more often with exercise? Well, I'm of the opinion at this point that we really need comprehensive behavior change. We cannot just stick a bike in front of these guys, in front of these patients, and really expect major benefits, not in all of them. And when you think about it, it makes some sense because exercise prescription should be more than sticking a bike in front of a chair. Standard physical activity recommendations include combinations of aerobic exercise, 30 to 60 minutes a day, not every other day for 20 or 30 minutes, strength training, balance training, flexibility training. This is an adequate exercise prescription, not riding a bike 20 minutes 3 days a week. So the amount of exercise we often prescribe to dialysis patients doesn't match what we know works best. Obviously, it's difficult to get them to do that much, so we're in a little bit of a catch-22. But nonetheless, we've got to prescribe more appropriate exercise. And I'm also convinced, and I want to talk about this for the next couple slides, that there's some nutritional concerns that's got to be addressed for the exercise to be effective. And the one I want to focus on is this chronic volume overload. Next slide. So if you remember my second anecdote with the guy DJ that drank the 10 liters of soda over the weekend, he was a patient that had chronic volume overload. And I'm convinced unless he got a hold of that, he was never going to get better. Why is this a problem? It increases blood pressure and cramping and lots of other symptoms during dialysis. My concern is that it also may prevent some of the benefits of exercise. Well, how common is it? Prevalence in the United States, there's some suggestions that might be more than 80% of patients have chronic volume overload. And this is where you just have excessive fluid on you that's not, taken off during treatment. The thought that statistic came from the fact that most people who have blood pressure, who are on dialysis, have high blood pressure on dialysis or hypertensive. It's probably due to the fact they have chronic volume overload. Not everybody agrees with that, but a lot of people do. So what can we do about it? Well, there's been some data showing that you can nearly eliminate this problem using intensive management of patients' dry weights, which includes a significant dietary salt restriction component in the protocol. And evidence of this is that in Turkey, one particular town in Izmir, they've got 95% of their patients off of all blood pressure medications, and they have normal blood pressure. Think about that stat for a second. In the U.S., about 80% of patients are on blood pressure medications, have high blood pressure. In this town in Turkey, 95% have normal blood pressure with no meds. It's an amazing stat. Next. So I'm not going to talk a lot about this, but I just want to talk a little bit about the keys to preventing volume overload. Really, one of the main components is dietary sodium restriction. Really, because salt makes you thirsty. If you restrict your salt intake, you can reduce your thirst. You're not going to gain as much weight. You're not going to have as much fluid overload. 3 main rules we discussed with our patients that are in our exercise programs now for reducing their sodium intake and reducing overload. Shopping for some simple rules on paper. Shopping for whole food. What we've tried to do is really liberalize some of the dietary restrictions on phosphorus and potassium. So the fruits and vegetables and grains and legumes and things like that that are normally healthy for patients' hearts are often restricted in dialysis patients. And I don't think that, I've actually written a review paper on this, I don't think those are very good restrictions for most patients. Usually it's okay for them to eat a reasonable amount of these things without their phosphorus and potassium levels going haywire. Second rule, if it's in a package, reading the label, talking about, this is really how to get away from processed food. And we've come up with something called the 1 milligram of sodium per calorie rule I'll talk about in a second. And then limit eating out. If you eat out, you're going to get a ton of salt. You can't avoid it. Next. So real quick, I just want to show you this 1 milligram sodium rule. I want everybody to go home and try this. Look at in your cabinet, some food that you have in there, or next time you go to the store, pick up the label, look at two numbers. The calorie number, in this example on the left, is 250, the sodium's 440. That sodium number is bigger than the calorie number. That's an indication it's highly processed, a lot of salt, and that's not good. As opposed to on the right, the sodium number 130, calorie 300, that's a better ratio. That's a better food choice. Doesn't work all the time. Skittles, lots of candy, looks like it has low sodium, but for 80% of foods, this is a pretty good rough estimation for how to look for low sodium food. Next. And this is sort of my punchline that you can teach anybody to do this. I taught 75% of these guys how to shop using the 1 milligram sodium per calorie rule. So it sounds complicated, but it's insanely easy. Hazel down there at the bottom, the 4-year-old didn't quite get it, but the other girls did. Next. So the reason this is important is because what we're trying to do is maximize the benefits of exercise by combining exercise and nutrition. I don't think you can divorce the two. So we developed what we call a volume control strategy, where we're using aggressive dry weight management to get patients more dry at treatment, real slowly, dropping post-dialysis weight, and then adding dietary sodium restriction to kind of get them, they're relatively healthy, like they've done in Izmir in Turkey. And then we add a comprehensive exercise program to optimize their heart health and physical function, really focus on strength, balance, and cardiovascular training. Next. So I want to talk a little bit about what I consider an ideal exercise program for dialysis patients. We'll talk next about what's realistic, but in an ideal world, and what we're starting to do, just to give you an indication of where I think we need to go. Two things. We have a dialysis exercise program that we that we implement during dialysis that involves intradialytic cycling, because I do think it's an important component of an overall program. But we're also doing some strength training during dialysis in their chairs, so using TheraBands and dumbbells and things like that. We're also what we're really trying to do is get the patients to move more often by any means necessary. At any moment when you're sitting around, there's lots of different ways where you can just start moving. When you're waiting in the waiting room, we're asking patients to do what we call chair squats. Sit down in your chair and stand up 10 times and do it, repeat that 3 different times. Walk around, become a pacer. Any free moment is a chance to move more. We're also working with the patient's family, getting them involved, and using, a lot of people need somebody to exercise with, and family members are a good idea to do this. We've got a wellness program and education sessions for patients' family. We also have a wellness program for the staff that we're developing now. The healthy staff can model healthy behaviors for the patients. I think that's very important. And we're also just we're not just about exercise, we're promoting some of the simple nutritional advice, such as the dietary sodium restriction. Next. And then we have a out-of-clinic program too that are mediated or implemented by physical therapists or exercise physiologists that use the dialysis period not just to exercise the patients, but to counsel the patients on how to incorporate more activity outside of the clinic. We got examples here. I've got a slide at the very end with resources, so you'll see these again at the very end. There's walking programs that we're promoting for at-home exercises, at-home strength and balance routines focusing on falls that are endorsed by the government to prevent falls. We're trying to identify exercise opportunities in the community, mall walkers clubs or free community fitness centers that are underutilized. We're trying to get the family involved to exercise with the patients. And really, we're trying to be creative and give them choices. I got this bullet here, how do you exercise? Does anybody out there exercise the same way every single day? In this case would be, riding a bike for 20 minutes during treatment. Nobody does that. It's boring, and so why should we expect our patients to do that? We've got to give them options. Next. Unfortunately, most clinics don't have in-center physiotherapists. They don't have any money for it. And so the question is, can you implement an in-center exercise program that's run by the existing clinic staff that doesn't have much exercise experience? And it is possible. It has been done, but it is incredibly rare. And I'll say this is the dose of realism here, I wouldn't get your hopes up that your clinic is going to adopt these programs, even though there are resources available, and we'll talk about it. It is possible. I've seen it done in amazing ways, but it's very rare. Next. So how can the dialysis staff support the patients? Well, they really need some training. And so somebody's got to pay for this. Who it's going to be is up to the clinics. But in our clinics, we're providing training and service to the staff to help deliver our exercise programs. We're developing a staff wellness program. We've got one with Fresenius. We have nicknamed for the time being WOW Fresenius, which is working on wellness for Fresenius. We've got some incentive programs for the staff. We've done something called a Fitbit challenge just to get the staff motivated. We give them Fitbits or pedometers, and they walk around the clinic, and whoever walks the most gets a prize. Just lots of creative things like that. But the truth be told, in the absence of a very dedicated nephrologist, which is rare, as a nephrologist is dedicated to exercise, they're busy, they have other obligations. The staff is unlikely to be a great resource for the patients. They want to help. A lot of them say they want to help, but they don't have the training or the resources to really do it. So long term, I think the best solution is try to convince clinics, Medicare, whoever, to pay for exercise specialists in the clinic, do renal rehab. Until then, it's up to the patients to get themselves educated. And that's one of the reasons I'm here, to try to help with this. The good news, it's not that hard to learn how to exercise. Next. So what do dialysis patients need to know if they want to start their own exercise program? Well, there's some general guidelines for all individuals, not specific to dialysis, I want to mention. And just some, a little bit of warning. I don't want to harp on this too much, but before start exercising, or if you should consider a couple of different symptoms, such as chest pain, if you have arm pain, particularly radiating pain, or high blood pressure or high resting heart rate, or if when you start exercising, if your blood pressure really goes up, and you see those numbers there. These are what are known as contraindications to exercise, indications that you should consider getting talking to your physician about these problems. Next. So what about other specific exercise-related considerations just specifically for dialysis patients? Well, there's not too many really, but there are a lot of myths that I want patients to be aware of, and the clinic staff as well to be aware of. A couple I'm just going to talk about these in random order that really kind of drive me nuts when I hear about these things. One is that a lot of patients don't believe they should lift more than 5 to 10 pounds with their access arm. And there is no evidence of this whatsoever. This does apply after your access surgery for a short time. However, dialysis patients refuse, oftentimes, it's kind of funny, they refuse to lift a 5-pound dumbbell, but they'll carry their kids, who weigh 30 pounds or what have you. So they can do this. That's a myth. You're not going to hurt your access by exercising, not during treatment, but outside of the clinic. All patients need, here's another one, all patients need an exercise stress test prior to starting an exercise program. I don't think this is a good idea. Now, it's never a bad idea to talk to your physician if you have some heart issues, but this absolute contraindication to exercising without a stress test, it's way too conservative a recommendation. The risk of not exercising is almost always greater than the risk of being sedentary. Third myth of sorts is that some physicians believe patients should really just spend their time sleeping during dialysis because dialysis is a big enough stress on your body. I think this is a horrible piece of advice. I think the dialysis period represents a very critical time to exercise for a variety of reasons, and I think it's important to promote that during treatment. Another myth is exercise during the third hour of dialysis is not safe. I don't believe this is true either. There's not a lot of good data to suggest this. Maybe if you have a history of low blood pressure during treatment, or if you have large amount of fluid removed, such as 1.3 liters per hour or more on a particular day. But other than that, we've exercised patients in the third hour all the time with no problems. Next. So what are some simple steps you can use to incorporate exercise into your life? Well, you may be aware of the fact that I wrote a blog related to this that was in support of this webinar. But just to briefly summarize what I talked about, we've engineered activity out of our life, and it's really easy to engineer it back in. Simple things you can do, and a lot of you have heard of things like this before, I'm sure, but making your life a little bit harder by taking stairs, parking a few blocks away from where it's work or the clinic. Sometimes when I'm taking buses around Chicago or Metro, I get off on the wrong stop just so I can walk more. That's the only chance I have to be active that day. Buying power-saving devices such as riding lawnmowers and snow blowers. I've gotten rid of as much technology as possible just so I can engineer more activity into my life instead of the opposite. I also think a good message, not getting pinned to a chair or couch. It's especially relevant for a dialysis patient where they are pinned to a chair so often. I have a walking workstation in my office, and I have a treadmill I can walk and work, or a lot of people have standing workstations. At home, when I'm watching TV, for instance, using commercial breaks to move, to do some push-ups, to walk around the house, what have you. And I've also tried to promote the fact that people need to become pacers. When they don't have a lot of opportunities to exercise, if you're on the phone, you're brushing your teeth, you're watching your kids' sports, you can walk around. You don't always have to sit doing types of activities like this. If you're motivated, you can find time to exercise. Time is generally never a reason to not get at least a reasonable amount of exercise. And the last thing, remember to make it fun and competitive. Signing up for races, finding friends to walk or work out with. And when I say sign up for a race, it can be a walking event, it can be lots of different charity type of things. But we got to remember, exercise used to be fun. Remember when it was fun. Remember when you were competitive, and try to get back there. Next. So just to wrap this up, clearly we've got a lot of data. So the dialysis patients are as sedentary as any clinical population that we can study. Most exercise programs to date, therefore most data to date, has looked at the benefits of intradialytic cycling. But there's so many more types of exercise we can look at. We know intradialytic cycling is a great start. It's a great activity, but we've got to do more for a patient population that has so many comorbidities. Physical activity inside the clinic, outside the clinic needs to be a priority. Both of them need to be priorities. And I also think we've got to address nutritional concerns. If you have patients that have chronic volume overload, or they're malnourished, or other problems like that, we've got to address these, or exercise is going to have minimal impact. Unfortunately, again, this is where the realism comes in the absence of a really dedicated nephrologist, which they're out there, but they're sometimes rare to find, or you've got to have an in-center physiotherapist. If not, the clinic staff is unlikely to promote exercise. They may want to promote it, but they don't have the resources or the support to do it. The good news is that exercise it's not that hard to learn how to exercise correctly in a way that's going to be beneficial. There are very good and easy resources to help get you moving, and these will be listed on the next slide. And I do want to leave you this. It is safe for almost all patients to engage in more exercise. You don't need a stress EKG unless you have some significant cardiovascular problems. And always remember, exercise should be fun. Find something you enjoy. And remember these anecdotes. These anecdotes, to borrow a line from Seinfeld episode, if you're a fan of that show, they're real and they are spectacular, these anecdotes. Next slide. Last message I want to make sure I reiterate. Simple take-home message. People ask me all the time, what's the most important type of exercise? And my answer is always, whatever you like, because that's what you're going to do the most of. Find a way to move more. Once you're doing that, maybe you're going to get motivated to try some new stuff and even some things maybe you don't like as much. But the important thing is to find things you like. Everybody can find something they like if they want to. And I think that might be it. Yeah, here's the resource page. So a lot of different resources. Life Options has a website. It's lifeoptions.org that's shown there. They have an exercise guide for people on dialysis, a guide for nephrologists, evaluation of units. So if there are staff out there that want to develop programs, this Life Options website is a tremendous resource. And then you've got some others as well. Resource packs. A group in Australia has put together how to do intradialytic cycling and resistance training. Got the websites there. Other organizations, you can find others that aren't on this page, but ACSM, American College of Sports Medicine, has a walking program that's really good. The CDC has put together a falls prevention program, tons of resources. Here, this is just a sampling of things that are out there and easy to understand if you're motivated. And I do think that is it. So just a picture of my lab and some others I work with. With that, I'm happy to take any questions.
Thank you so much, Dr. Wilund. It's been very, very informative, especially as we start the new year with so many people thinking about New Year's resolutions and getting more active. So I think your webinar is definitely very timely as folks are trying to figure out how they can be more healthy. So we've definitely gotten a lot of questions, and I do encourage folks, if they have any questions, to go ahead and type them in the box, and we'll prioritize them now. So for the first question, what level of activity is considered inactive? 0 steps per day, 0 to 1,000 steps?
Yeah, to be honest, I'd have to look that up, but it's really low. I mean, there's I think it's something on the order of if I had to guess at a step count, I don't know if they've broken down like that, but it's on the order of couple thousand steps a day. Anything less than that, somewhere around 1,000 probably. They've got it broken down in different ways, and I think I'm going to get it's going to be real close to probably 1,000 steps a day, somewhere around there.
Okay. And then here's a scenario for you. So a listener ran 20 miles a day while he was on hemodialysis. He says it freed him from water restrictions and helped him feel happier in his life. Now he's had a kidney transplant and is on immunosuppressants, and he worries about bone density. Is it still safe for him to run as much as he did before he had his transplant?
Absolutely. There's been some really interesting, I didn't talk about transplant patients, but there's not a lot of literature on transplant patients. So what there is I mean, they have, these transplant games. I don't know if you've heard of this national transplant games where they have all kinds of activities for transplant patients. It's the Olympics for transplant patients. So there's no question that high levels of activity are just fine for transplant patients. And it's obviously you want to listen to your body and things like that, but there's no inherent reason why a transplant patient can't run.
Okay, that's good news. So the next one is.
Can I add one more thing on that? I don't want to.
Oh yeah.
Incredibly important piece of data that hasn't been published yet, but a colleague of mine in Chicago has got data showing that exercise programs in transplant patients have significantly improved reemployment rates. So your ability to get healthy enough to get a job is improved by getting on an exercise program as a transplant patient, and that's a tremendous outcome that's not normally measured.
Mm-hmm. Right. That's very good. Okay, so a listener says that his exercise routine helped him, but not only himself and his family, because they felt the stress was relieved while they were exercising. Have you seen patients' motivation to exercise increase when they see that it benefits others, including their family?
Absolutely. No, that's where we've had our biggest success is when we've had patients and their family get their other family members involved. Now, it can go either way. It can be the family member being concerned and helping convince the patient, or it can be the patient, getting their family member involved out of desperation or just want. And when they get family members involved, that's why a big focus of what we're doing is trying to get family members involved. Unfortunately, some of our patients have been hesitant to get us in touch with their family members. I'm not real sure the reasons why that is all the time, but when we have, that's been the greatest benefit. That's when we see the greatest benefits.
Right. Okay, that makes a lot of sense. And someone else asks that one of her personal goals is to reduce the number of medications that she takes every day. How can exercise help her achieve that goal?
The only thing that I can say with absolute certainty, because I've seen it published, is that there's several studies now that have shown that exercise reduces the need for blood pressure medications. And these are a couple different studies that use intradialytic cycling that helped improve blood pressure enough to reduce blood pressure medications. So I know that's been shown several times. That's one way. In terms of, what are the primary medications that dialysis patients are on? Blood pressure medications and phosphate binders. There is some data that exercise improves phosphate removal during dialysis, so potentially would reduce the need for phosphate binders, but I've never seen data demonstrating that for sure, so I can't say that for sure. But if you can, those are the two big ones, and they would certainly, I would imagine that exercise might reduce the need for EPO as well. There's some evidence that exercise can increase erythropoietin. So, but I've never seen that data either.
It's still always a good idea to exercise, because it improves your overall health, right? So the next question is, in relationship to your specific exercise programs and the research that you're doing, do you integrate motivational interviewing into your programs?
So that's a great question, and we do. I've had several of my students take motivational interviewing classes, and we use another technique called it's behavioral change strategy, social cognitive theory, which has some overlap. But yeah, we are doing a lot of things to motivate our patients and affect their ability to change their behavior using psychological approaches. Motivational interviewing per se, we kind of touch on, but it's not a major focus of what we do, but we have certain principles that have motivational interviewing, because I think that is something that is really important. It gets back to what we've done in the past is just stick a bike in front of these guys. What we really need to do is figure out why they're inactive and motivate them to be more active, not just trying to shove something in front of their face and make them do it. So it is, while we don't use motivational interviewing per se, we do use components of it and other similar strategies.
Okay. And this one here makes a lot of sense. So if you exercise, you can get really thirsty. So what do you suggest, somebody can do if they're feeling really thirsty and exercising and they're on fluid restriction because they're on dialysis?
Okay, it's another great question. So I'm of the mindset, if patients are thirsty, I hate fluid restrictions. I think fluid restrictions are a bad idea and a waste of time, because a patient, if they're thirsty, you cannot stop a thirsty person from drinking. And if they're thirsty because they've been exercising, that means they've lost some sweat and body fluids, and they need to drink. They don't need to drink excessively, though. Again, I always talk to my patients about when they're thirsty from exercise or otherwise, pour a small glass. Then if they're still thirsty 10 minutes later, pour another small glass, especially if they've been sweating a lot or if it's real hot outside. But thirst is more about salt than instead of, let me put it this way, instead of restricting fluids, if you restrict their salt, they're not going to be as thirsty. Yes, they'll be thirsty from exercising. That means it's okay to drink because they've lost that fluid. That's why they're thirsty. So I don't like to talk about fluid restrictions. And if a patient's thirsty, you're not going to stop them.
Okay, that makes sense. And to switch gears a little bit, are there any different recommendations for exercise regimens for peritoneal dialysis PD patients versus hemo? Or is it the same recommendations for both groups?
Yeah, it's really the same recommendation. The only real difference is you're not going to, worry about the intradialytic part because, they're more free living. But so yes, it's the balanced approach of trying to incorporate rule number one is always, what do you enjoy doing? Do more of that. But then that's the same for PD or hemodialysis. But other than that, you still have muscle wasting associated with PD, of course, so you want to incorporate some strength training activities. Balls are a big problem in both populations, so you want to incorporate some balance type activities, which sometimes those are also strength activities, but there are some subtle differences. So yeah, overall they're the same, just without the sort of intradialytic cycling part.
Mm-hmm. So this one here came from, looks like a healthcare professional. What can dialysis centers do to encourage patients to be more active? Do you have a couple of tips for the professionals who are listening?
Yeah, I would encourage every professional out there that is interested in this to go to that Life Options website and look at those materials. And they do a really good job of demonstrating how you can incorporate exercise into clinics. I don't know why those aren't used more often. Maybe people don't know about them. I think they're wonderful. Patricia Painter, who's kind of the godmother of exercise and dialysis patients, was responsible for putting a lot of that material together. She did a great job, and I encourage people to use them. That's the main thing. But again, in addition to that, just making sure they understand two simple messages. One is talk to the patients about what they like to do, promoting that. And the second thing is don't treat them with kid gloves because they're on dialysis. They're capable. They can do more, and encourage them to do more, and don't be overly concerned about the fact that they're dialysis patients. If they have cardiovascular problems, fine, you get them checked out, but they can still do something.
Okay. We probably have time for just a few more. This one here is about resistance bands. So you mentioned that they're not really recommended for dialysis. Could you explain a little bit about why that is, or why they're difficult to use?
Oh, I didn't say. If I said that, I misspoke. The resistance bands, we use those. I think they're difficult to use. What I've mentioned is that it's difficult to do resistance training during dialysis when you're sitting in a chair, and the reason is just because you're not mobile, and you've got you've got to keep your access arm still, and so when they've done resistance training, it's generally the upper body exercises are with one arm, and you can do that. You can do curl, you can use a dumbbell, you can use resistance bands, stick it under your leg, and you can do curls and all kinds of. And if you look in that Australian resource pack, they've got band exercises in there. So the resistance bands are great now, and you can do lower body exercises with both legs. And then if you want to do an upper body exercise, and certainly at home, you can do both arms. Before and after dialysis, you can do both arms. But no, I think the resistance bands are just fine, especially for starting out, because there's kind of lower resistance, and you can build up to doing other things like heavier weights and stuff like that. So if I said resistance bands are bad, I misspoke.
And then one here question about eating out. I know that's definitely easy for so many of us, but a lot of restaurant foods are really, really high in salt and fat. So if a patient is out and has to eat out and pick something from a menu, what are some things that they can be looking for that are healthier options? Are there specific things to look out for or to request that are on the healthier side?
Yeah, I would say the easiest thing to do is request all sauces, condiments on the side, including salad dressings. And the reason so condiments, I'll go one step further, and all bread. So if you're even getting a hamburger, for instance, eat it without the bun. So two of the biggest sources of salt in the American diet and in our dialysis patients that we've measured is bread and condiments. Those are number one and number two. Sausage and bacon, processed meats are number three. But if you stay away when you go out to eat from bread, which has got a ton of salt in it, and the condiments, which has an unbelievable amount of salt in it. When I say condiments, barbecue sauce, tomato sauces, what have you. Mustard's generally okay, but get those on the side. Salad dressings are loaded up with them. I ask my patients, some of them, refuse to do this, but others have. Bring your own salad dressing to a restaurant. It's not. It sounds ridiculous on some level, but I do it myself because I'm trying to promote the same. I'm trying to do the same thing myself, seeing what it's like. Well, what are we promoting in our patients? I'm trying to do it myself, so I know what it's like, and I bring salad dressing to restaurants. I don't, eat hamburgers with buns. And you can really reduce the amount of sodium if you do those two things.
And then it looks like we got one more question. It looks like it came from a healthcare professional. What kind of lower body exercises can patients do while they're sitting down on the dialysis chair?
Sure. We've really come up with 5. There's others that are out there, but there's 4 or 5 that seem to work reasonably well. And if you look in that Australian resource pack, I think they're probably all described in there. And if not, I've got a handout that I can send anybody if they want it, because we've got them described really well. There's with bands. We do all ours with bands or with ankle weights. And there's a leg press that you can do. There's a leg extension. There's a leg curl. There's an abduction. So it's again, without the picture, it's hard to describe. And there's calf raises. So those are 5 activities you can do with bands, and it's again difficult to describe, but I'm happy to send you our exercise descriptions and how they're done.
Yeah, it would be great. We can definitely circulate it and send it around to our listeners. That way they can take a look at these exercises and start implementing them right away. So
great.
From all of us here, Dr. Wilund, we wanted to thank you very much for being available and talking through all of these really great tips, and exercise is such an important part and difficult for everybody, even if irrespective of being on dialysis or not. It's definitely a life commitment, and it can be challenging. So we really appreciate you joining us and kind of giving your perspective and letting people know that it's really not as scary, as hard as some people may think. Okay.
That's
so
great.
for folks on the phone, So for folks on the phone, our next webinar will be held on Tuesday, January 21st from 2 to 3 p.m. Our speaker, Dr. Poffenroth, is an experienced primary care physician, so a primary care doctor. One of his primary goals has been to help patients prevent and manage common chronic diseases that can lead to kidney failure, including diabetes, high blood pressure, and cardiovascular disease. Currently, Dr. Poffenroth is Chief Medical Officer for the Signature Partners Network at Innova Healthcare Systems. In recognition of American Heart Month, Dr. Poffenroth will discuss the connection between heart disease and kidney disease and how to best protect yourself if you have either one of those things. Registration is now open, so visit kidneyfund.org/webinars for more information and to register. When the webinar closes, please do not close your browser window. You may see a pop-up saying that the webinar has ended. Please go ahead and close that pop-up and proceed to the webinar evaluation survey. Your honest feedback will help us make our webinar program the best that it can be. And from everybody here at the American Kidney Fund, thank you so much for joining us today, and we'll be looking forward to talking to everybody next month.